In this video tutorial, I am going to discuss about plasma enzymes. So what are plasma enzymes? Plasma enzymes are the enzymes present in the plasma. Remember, they are not synthesized by the plasma itself. They are simply present in the plasma, and that's why we call them plasma enzymes. It is important to remember that all enzymes are produced inside the cells. Enzyme synthesis never happens outside the cellular environment. However, a small subset of enzymes, after being synthesized within the cells, appear in the plasma. We call these enzymes as a plasma enzymes. Now, plasma enzymes can be divided into two groups based on their site of function. The first group is plasma functional enzymes and the second group is plasma non-functional enzymes, which is also called as plasma non-specific enzymes. Let's first look at plasma functional enzymes. As the name suggests, they are functional in the plasma, meaning they have a specific function there. Once these enzymes are synthesized by the cells, they are actively secreted into the plasma because their primary function occurs in the plasma. Therefore, the activity of this enzyme is generally higher in the plasma compared to the tissue. Plasma functional enzymes can be synthesized by various cells. However, the liver is the major organ. Now, after synthesis, they are secreted into the circulation and appear in the plasma. Examples of plasma functional enzymes include lipoprotein lipase, plasmin, thrombin, pseudocholinesterase, ceruloplasmin, etc. Now, whenever there is a disease condition that affects the normal function of the cells, those cells will not be able to synthesize plasma functional enzymes in proper quantities. So, in such disease state, the activity or level of these enzymes in the serum generally decreases. Now, let's look at the plasma non-functional enzymes, also called plasma non-specific enzymes. As the name suggests, they have no specific function in the plasma. Naturally, once these enzymes are synthesized by cells, they are not normally secreted into the plasma. Therefore, the activity of such enzyme is very low in plasma compared to the tissues. Plasma non-functional enzymes are further divided into two groups, secretory enzymes and metabolic enzymes. Secretory enzymes are named so because once they are synthesized by the cells, they are secreted into the extracellular space. But remember, their functional site is not the plasma. What are the examples of enzyme that are secreted by the cells but whose functional site is not plasma? The perfect example is digestive enzymes such as amylase, pepsin, trypsin, lipase. On the other hand, the metabolic enzymes are not secreted by the cells at all because their functional site is intracellular only. They are involved in various intermediary metabolic pathways. Since they take part in the intracellular metabolism, we call them as a metabolic enzymes. Examples of metabolic enzymes include lactate dehydrogenase, transaminase, alkaline and acid phosphatase, creatine phosphokinase, and many more. Now, the question arises, if secretory enzymes functional site is not the plasma and metabolic enzymes are not secreted into the plasma, how and why do they appear in plasma? The simple answer is normal routine cell turnover. As a part of routine cell turnover, some cells undergo natural death while new cells are synthesized. Because of this natural cell death as a part of routine cell turnover, the cellular contents will spill over into the plasma. And that is the exact reason that why some minimal or basal amount of this enzyme is present in the plasma. These plasma non-functional enzymes, including both secretory and metabolic enzymes, are clinically very significant. Whenever there are disease conditions that leads to either cell damage or increased cell turnover or cell proliferation like in malignancy or tumor or increased synthesis of enzyme, the level of this plasma non-functional enzyme is increased in the plasma or serum. So, If we measure the activity of this enzyme in the plasma or serum, they can help us in the diagnosis of various diseases. Now, which enzymes are elevated in which disease, that will be discussed in the next video. So, this completes our discussion for this video. I hope that all the concepts are clear. If you have any query or confusion, please write it down in the comment section below. Thank you.